Okay, we are going to be seeing Miss Millie Lawson again. We are going to be administering Cipro 200 milligrams per 50 mLs, 0.9% sodium chloride intravenously, IV piggyback, run over 30 minutes. The drop factor is 15 drops per minute. The patient has no known drug allergies. So let's do our math real quick. 50 mLs over 30 minutes. 15 over 1, 25 drops. Minute, 50 mLs over 15 is 500, 750, 200. Alright, so we're going to do 25 drops per minute. Okay. 500. Okay. Alright, we're going to wash our hands and we're going to get the supplies that we need. We have our alcohol swabs. The patient already has the normal saline running in the primary tubing, so we're going to piggyback the Cipro with the primary tubing. So we have our secondary IV set, and we have 50 mLs of 0.9% sodium chloride. The date is within use. It is not expired. All right. So now let's get everything put together. Alright, we're going to open up our fluid bag and get it open. So we are going to throw that away. We're going to make a label, and it is date home would be today, time home would be 17:27, and it is to run over 30 minutes. 17:57 will be the end time. Sign, and this is Cipro, so we're going to label it Cipro 200 milligrams per 50 mLs, and it is to run over 30 minutes, so it would be 25 drops per minute. So the label that we are going to use, and the integrity of the bag and everything is intact, so we're going to label that. More hand hygiene. Alright, get this. So, we're going to make sure we have the right drug, right dose, right patient, right route, and right time. We're going to double check it again. It's Cipro 200 milligrams per 50 mLs into sodium chloride, which is normal saline, and it is going to run over 30 minutes. Okay, we can go ahead and see the patient. We did a hand hygiene, put on gloves. We're going to verify name and date of birth, which is Millie Larson. Birth date is 1/1/1936. We have all our supplies. We're going to provide privacy as necessary. So we have, we have our secondary tubing line. I'm going to go ahead and hang that up right here so I don't drop it. All right. And so we have our secondary tubing. I'm going to clamp it off. We're going to get our Cipro. I'm going to pop the blue top off. And without touching the spike, we're going to invert the bag and spike it. Okay. Now we're going to hang our bag. Let's see, we have hung the second bag. Now we're going to fill the chamber to halfway. And we're going to prime our tubing without letting any fluid escape, and making sure we have all the air out of the IV line. Okay. All right. Now we're going to lower our primary tubing. And we have it clamped. Okay. I'm going to doff our gloves. I'm going to perform hand hygiene. Alright. We're going to check one more time. Order. We have the Cipro, we have the patient, Millie Larson, 1/1/1936. We're going to check the IV site for patency. There's no redness, the IV is patent, no signs and symptoms of infiltration, no tenderness, no pain, no redness. It is flowing. After we do that, we will get our antibiotics running. Let's do some more hand hygiene. Alright. Get this connected. Next, we're going to take our alcohol wipe and we're going to scrub the hub of the port that is closest to the patient, which is where we will be connecting our secondary tubing for the antibiotic. So that port is this port. So we're going to scrub vigorously. And we are going to let it dry, of course, and then we are going to take our Cipro line and we're going to screw in like that. Now, the patient is connected to the secondary tubing with the Cipro. The primary tubing is now hanging lower than the secondary tubing, so it will be able to infuse. We're going to make sure that we have 25 drops per minute, and then reassess the patient. So we're going to count our drops to make sure that we have the right flow rate. So we're going to do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, slow it down, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, and 25. And we will keep reassessing that to make sure that the drip rate continues to be for 1 minute to make sure it's infusing at the proper dose. I'm going to take those off and perform hand hygiene. We're going to assess our IV after it has started running again. There seems to be no signs and symptoms of infiltration. There's no adverse reaction to the patient. No signs and symptoms of distress. She's tolerating it well. So now we will document the results. So we will come on here and it's sick row for UTI. So we will 1727. It's 25 drops per minute. Injection sites, right forearm. It's Peyton. No signs and symptoms of infiltration. We will sign. We will initial. And we filled out our MAR with all of our information. And we'll check the patient. There's no adverse reactions. And wash our hands, and we will leave the room. And that's it.